A time that I had to bring up an uncomfortable issue with a coworker was during my rotation. I was placed on the unit, so pretty much the whole patient population was. And while I was at the nurse's station, the PCA kept making comments that I didn't feel were very healing for the patients or very respectful, in my opinion. And she was making these comments at the nurses' stations, but all of the patients had to have their doors open because of supervision purposes. And I just thought it would be very easy for someone to overhear those comments. And especially given the patient's ages, I think that things like that can really affect them. And they're definitely in like an emotional state at this time and they're going through something hard. So these comments were making me uncomfortable. And I just said, hey, I don't think that these comments are very healing for the patients, and I don't think that we should be saying these things, especially when the doors are open and they might be able to overhear you. And she just said okay, and the conversation didn't really go anywhere. But my goal in that is that hopefully before she says things like that, she at least has a second thought and it can just remind her to think about things before she says it.
Okay, I like that. It's something that's really hard to do, especially when you're the student, you know?
Yeah,
But good job for doing that. It's even hard when you're a few years in.
that one felt more like a time I had to bring up an uncomfortable issue with the coworker, but for my conflict with the coworker, I was going to talk about like a time that I was paired with a preceptor that made it so clear she didn't want a student and
Oh,
actively said when we were in the break room getting the morning assignments, she was like, I don't want a student. And then, like, I found out later during the day when we sat down to chart, I just asked her if, like, she wasn't really letting me do anything. And she was just doing everything so fast and just going. And I was just trailing behind her watching. And I was like, is there any way I could be more involved? I would love to, like, learn from you. And she was like, oh my gosh, I'm so sorry. This is the new grad student. She was like, I'm so sorry. Like, I'm a new grad myself and I'm like so overwhelmed and they keep giving me students and I didn't mean to be leaving you out. And after that, I tried to get assigned with her because we formed like a good relationship and we would kind of help each other out. So
clearly there were things that you were doing that helped her stress. What were those things?
I would just help her go do people's assessments, go do orders that I was able to do, that sort of thing. And I feel like I'm very good at taking initiative. I can see on the brain what needs to be done. And I would just ask her, hey, can I just go do this for you? And things like that. Or if we would be in the room together doing something that I felt comfortable on, I was like, if you are fine with me doing it, you can leave and I'll finish this if you need to go do something.
Oh, that's so nice.
Help.
Okay, yeah. You could use that for a time that you had a conflict with a coworker, a time you helped someone perform better at their job, a time you had to give feedback to somebody. You could
Just
do that for either the negative or the positive side of these, like communication, teamwork, collaboration type of things. Sometimes they ask about a time you had a conflict with a supervisor, and that would be the nurse that you were assigned to.
okay.
So for this patient specifically, when I was shadowing my nurse, we were administering medications for this patient on a unit, and the medication was metformin. And I noticed that each time my nurse was scanning like her metformin, it was like saying something about like exceed dose, exceed dose. And at that point, I was kind of wondering what that meant, and I was like, "Hey, I don't know if you saw, but it said like the dosage was exceeded, and like it was really hard to miss it because each time you scan it, it would show up and it would ask you to override and click yes. So then I asked the nurse like, "Oh, like does that happen a lot?" She's like, "Oh, that's okay. Like that normally happens with her medication." And then to me, like as much as I want to let it go, I just didn't feel right to me because I was still really fresh in my nursing career. So I was really like curious. I was like, why is it doing that? So I was reading the tablet that she had, and it was I don't remember, I think it was 30 milligrams metformin, and her dosage that I was saying it was 15. So I think what had happened was the nurse was giving more dosages than what the patient actually needed. And at that point, I try to come off respectful to the nurse instead of scolding her. I was like, "Hey, I just want to be honest, straightforward with you. I think that the dosage that she needs is actually a little bit lesser than what we were scanning." And I was like, if you want to take a look, we can both double confirm. And she saw that and she's like, oh, like you actually caught my mistake there. Like I really appreciate you looking after that because she said normally sometimes my coworkers would say that's fine, but you were really adamant and really triple checking what I was scanning. And I think she thanked me for that. And from that, I really felt I would save this patient because what if we overdosed her on metformin? That definitely would have been bad in the long run. So I just learned that sometimes when you see something that you're not comfortable with, always just approach it in a professional manner and try to like hear each other's opinions and resolve the conflict there.
Yeah. Yeah, I like it. You know how firehouses or like the military, there's like almost a hierarchy.
Yeah.
If you don't like play your cards right,
Yeah.
they'll come down on you.
Mhm.
Nursing is like that. So I would almost say, is this here is where it says the dose, right? And
Mhm.
maybe she said, right. Oh, I see. So it's supposed to be 15. That's why it's giving me so you know, pointed it out by asking a question for your education to kind of lead her to see because you wanted to be respectful and it's possible that there's something that you don't know or don't understand that she could teach you. You know what
Mhm.
I mean?
Yeah, yeah,
With
totally.
the doctors, right? Like the people who always get in fights with the doctors are the ones that don't kind of do that dance, right? They'll say, if you get an order that like makes no sense for your patient, instead of being like, what the heck is up with this? Like some
Yeah.
nurses might do, you could say, I want to be able to understand so that if the patient or the family has any questions about it, I'm able to explain the indication for this patient. For my education, can you tell me how we're using the med for this patient? And they might be like, I didn't order that for that patient. Oh, shoot. Hang on. Don't give that. That was for another patient. You gotta kind of
Okay.
like lead them in a very like unassuming way.
Yeah,
You know,
yeah, yeah. Okay.
is there a way that you could do that for this?
Um,
Or yeah, maybe just is
so
this part here where it says the dose that
yes,
we give?
so like for example, like on like a wrapper for like a medication, it would say
Uh-huh.
like 30 milligrams like per one tablet or something on the thing.
Uh-huh.
So I think on there like it said that and I was like and I remember saying, hey, what is the usual dose? I asked her, what's the usual dosage for a metformin at like for this type of patient? And she said it ranges from like I think 10 to like 40 depending on like the doctor's orders. And I was like, oh, I was just asking just because like in future references, I just want to know what the proper dosaging is. And I kind of pointed at the patient's chart and I was like, on here it says 15 and this one says 30. So are we splitting the pill? Like, how does that work? And
Yeah,
then,
that's it.
and then I think that's when she realized that it was not the right dosage.
Yeah.
Okay.
And maybe to say because she's so knowledgeable and I'm new, I wanted to really make sure that I'm asking the question in a way that is respectful and supportive and not judgmental, but I also knew it's my job to advocate,
Oh,
especially
okay.
if I
That's
think I'm
tying in everything
here.
together. I see.
Yeah.
Yeah, I
Yeah.
like that. Okay.
Yeah, it's like a special skill because it's like if you just play the hierarchy game, the patient takes the fall. You know what I mean?
Yeah, because
Yeah.
patient safety is important at the end of the day, above
Yeah.
all.
Yeah. You could use that for, yeah, a time you had to give feedback, a time you had a conflict with a coworker, a time you had
Mhm.
a conflict with a supervisor. What if they say specifically a doctor? What if they say like working with doctors can be stressful? How would you handle a conflict?
For that one, I'd be like, I always like to humanize people in every situation I'm in. And I know that, if a conflict arises with a doctor, there's always an underlying premise as to why that is. And I'd go something along the lines that, like, I would first try to talk with the doctor with respect in a professional manner and ask him if there's anything that I can do to help improve that conflict that we have. Is there something we can do to talk it out to resolve this conflict? And if I notice that the actions that we're doing is not being resolved, if I still notice that conflict hasn't been resolved, then I would try to involve the charge person to see if we can work together to resolve this conflict. And I think from there, it's just important to really hear each other's opinions out because it could have been something really small. And if we were able to fix it together, it can improve our relationship moving forward.
Okay. Yeah, I like it. And then making sure that you really keep the focus on the mutual goal of doing what's going to be best for the patient, making
Okay.
sure that you really understand.
So should I say like I always try to humanize people for any conflict I'm in, but I know in a hospital setting, I have to ensure that my patient safety is the number one concern, and then talk about like
I
uh
mean,
uh,
maybe just like as a, I liked what you said, maybe just as an added thing,
oh, okay.
to make sure that I'm approaching the conflict in a way that is supportive, seeing what I can learn, seeing how I can help, making sure that I'm keeping my focus on doing what's best for the patient. Um, yeah, I feel like you can say all of those things, but I would tell this story because you could say, I haven't had a conflict with a doctor, but
Mhm.
I've had to advocate to prevent a med error with a nurse that I was
Mhm.
following that was supervising me for the day and talk about that.
Okay.
Um,
Yeah, definitely.
yeah. I've gotten a lot of great feedback from you guys about the questions list with the 72 questions. You guys can get that for $3, by the way, with your discount code YouTube. And I wanted to build something for you where you can build out your answers on your phone that's really easily accessible. There's 33 of the most common questions that I put into a Notion template. If you don't use Notion yet, you should check it out. It's a really cool app similar to the Notes app, but it's very customizable. You can add pictures to it, you can change the colors, make it look how you want it. For each question, you get guidance on things to include, things to avoid talking about, example answers, and then there's embedded YouTube videos where you can watch other new grads give their example answers. And there's a notes section where you can type into and save your draft of your answer and start building your answers when you're waiting for the bus, or you're waiting for post conference to start, or you're in the kitchen cooking pasta and waiting for the water to boil, or just whenever something comes to you, you can just put it right in your phone in a way that's super easy to go through. You can also use the Notion app on your computer browser, you can use it on a tablet, but I wanted something for you where you can just little bit by little bit, or over the course of a night, if you have an interview tomorrow, start building out your answers in a way that's easy to break down with a lot of examples to help jog your memory for examples from your clinicals that you may have forgotten about. This is just a very streamlined way to start throwing in ideas and how to build out your answer in a way that's going to be very easily accessible on your phone.